referral hospitals in the country. Raquel Muigai was at the hospital this morning and joins us with an update on what really was happening. Raquel, you said the nurses had resorted to picketing?
That is actually true. The Kenyatta National Hospital is a referral hospital at this in this country, and therefore, given that the nurses' strike began in the 5th of June, now enters its 57th day, all the cases have been referred from the counties to referral hospitals, Kenyatta National Hospital being one of them. And at this particular point, the Kenyatta National Hospital nurses are saying that we are being overwhelmed, we are being stretched because they're now handling cholera cases. Cholera is the cholera outbreak just began in a few months ago, and therefore they have now been dealing with cholera cases instead of dealing with other more serious cases, as they said. And therefore, they feel that the government should be able to do something because those that are in dire need of medical services, those that cannot be able to afford private healthcare, are being referred to Kenyatta National Hospital, which is one of the largest, it's the largest referral facility in the country. And therefore, they are being overstretched. They're being left to handle cases that are meant to be handled by the counties within the county hospitals. And therefore, they want the government to do something about it, to get and sign and register the 2013-2017 collective bargaining agreement so that the nurses can return back to work.
Raquel, it's been 57 days. One would wonder, where have they been for all this more than 50 days? What really rattled them off like that?
Now, this is what happened. The nurses within the country went on strike, leaving the referral facilities, the nurses within the referral facilities ongoing with the duties, given that the referral facilities are under the national government and not the county governments. Now, the nurses went on strike on the issue of the lack of signing and registration of the collective bargaining agreement, in which they were requesting 40 billion. And if you can remember, Kisa, just when the strike was beginning, the early days when the strike was beginning, the COG, the Council of Governors, stated that that amount was very large to actually accommodate, given that it goes against the public service pay. And also there was the push and pull between the Council of Governors and the SRC, that's the Salaries and Remuneration Commission, stating that they have to renegotiate and look at what amount they can be able to offer the nurses. But the nurses remained adamant, stating that if the doctors were able to receive an increment of over 150% increase, why is it that they, as the nurses who work within the same hospitals, why is it that they cannot be able to receive this certain amount? And out of that 40 billion, all they wanted within this particular CBA was an equity and also an increment of the salaries that they had that just cuts across all the nurses. One of the allowances that they were asking for was the house allowance, in which they felt there was a difference in payment or how the rates were being allocated, given that if you were staying within the counties, then your rates are meant to be lower, differing from that particular nurse who stays within the city or within a major town. They're also asking for the health risk allowance, given that the kind of duties or the kind of cases that nurses get to handle puts them at a risk of getting infected or just puts their health at risk. They're also asking for the grading. These are some of the things that the nurses were asking for. And it's something that the government still hasn't decided who is yet to handle, who is meant to handle the nurses' strike, the push and pull between the COG and the SRC being there. But the nurses state that they're not going back to work, they're not renegotiating the amount that they requested. All they want is the signing and registration and the implementation of that CBA, given that it was meant to be implemented on the 1st of July, and that date has due passed.
Okay. Raquel, thank you very much for that update. In the next 48 hours, we expect the government to react, or if not, the nurses say that they're going to down their tools. The nurses, specifically from the Kenyatta National Hospital, the referral hospital, are expected to join their colleagues in the next 48 hours. Now, presidential ballot papers have already been loaded and are waiting for the flight to Kenya just 7 days to the election. The papers will arrive in the country today from Dubai, where they were printed according to the IEBC. The ballot papers will be in 416,360 booklets